analysis. I'm going to give you a quick update on the dashboard and then answer some questions that I've received over the course of the week in relation to the health officer dashboard. So looking at the health officer dashboard, we continue to be on a downward trend with our health officer dashboard score. We're very close to moving into a yellow on the total score. I would anticipate this week that we will be able to move down into a yellow based off of a decrease in the number of new cases that we're seeing in Grand Forks County. And I recently added the change arrow to give you an idea of where things have gone since the day before. So that's just simply a look at the day before on the trend. Our percent change continues to be are showing a downward trend. Our tests completed continue to be strong, and our percent positivity is on a downward trend as well. Looking at our numbers from that were reported today from yesterday, we had 32 new cases, which is an increase. We still had a high number of tests completed, even though it was a weekend. And percent positivity was a little bit higher for yesterday. And we have 262 active cases in Grand Forks County. Again, looking at the health officer dashboard, as I mentioned, we're on a nice downward trend. I hope that we can get down into yellow this week with the decreasing number of cases. And then the percent change, looking at the score itself, does continue to show that downward trend as well. Our average number of cases, we did peak at over 90 cases per 100,000. And just to clarify, per 100,000 is just a way for us to express a rate that can be compared to other locations. So we have about 70,000 people in Grand Forks County. So if you're wondering what our actual number is, our actual average, you just take that by essentially 0.7 to get an idea of where we're at. I also use per 10,000 rates as well, and that's just moving the decimal point one spot to get down to that 10,000 rate. The governor uses rates per 10,000. I've been using rates per 100,000. The governor uses rates per 10,000 because we have a lot of rural counties in the state. Rates per 100,000 are what we use because we are relatively comparable size-wise to what gets compared on a national level. Looking at our number of tests per 100,000, we continue to be relatively strong. We've had a small decrease from our peak with the start of school, but I would anticipate we will still, stay very safely in the green area with the number of testings that have been scheduled looking forward. Looking at the percent change, again, that's on the percent positivity, that is on a downward trajectory, which is very good. The percent change is one of the factors that does make a big difference on moving the dashboard since it is weighted relatively high. So if we keep up with the decreasing number of cases as well as the strong testing program, we could see that very easily go down into the green, which would be less than 1%. And our percent change, again, is on its way down. Comparing Grand Forks to other North Dakota metro areas, this is the state of North Dakota. We continue to be on kind of an upward swing, unfortunately, as a state. Grand Forks is now below the state rate, which shows that we are moving in a good direction. Burley County tends to kind of set the bar for the state on the most number of cases, and their increase has been very steady, whereas ours was more of a peak. Cass County has also been seeing an increase. Some of that has been tied to NDSU, some of that has been tied to community spread. And then Ward County, it looked like they had a small peak, they dipped back down, and now they're on the way back up again. As far as I know, they are attributing that related to cases at Minot State University as well as a couple other locations in the community. What they see in Burley County is, as far as I'm aware, is widespread, kind of more community spread. So they've been seeing it in, a variety of age groups. They've been seeing it in a variety of locations, throughout the community. And I think that's why it's been a lot more sustained than ours, where, a lot of it was localized on a particular community. And then looking at, this is actually percent positivity, I didn't change the header. So looking at comparison of percent positivity, this is North Dakota. We're running, the state of North Dakota is running, closer to 5% for the percent positivity, and that's looking at the number of new cases in the numerator, number of tests in the denominator. Some programs are looking at the number of new cases divided by the number of unique tests. We just use the same numerator and denominator to make sure that we're comparable. Grand Forks, again, we've been on that downward trend with our percent positivity. We're about 3% right now, which is trending in a very good direction. Looking at Bismarck-Burley, they continue to increase. They're almost up to 7% positivity, which is obviously not a very heartwarming trend. Cass County has been a little bit more variable. You can see at their peak when they had an outbreak in May, they were up almost to 9%, and now they're well over 5%, similar to the state average. And then Ward County has been going up as well, kind of matching with their increase in cases. Again, a couple weeks ago, the governor did change the risk levels and add the guiding metrics to adding risk levels to each individual county. And so I have been doing my best to keep track of what the governor is looking at to kind of compare that to what our dashboard looks like. The methodology, I haven't gotten a full clarification of the methodology, so I am still using my best estimation. And Grand Forks is still in the yellow. And then looking throughout the state, the governor did not make any changes to the counties at risk during his news conference today. Looking at the governor's metrics, what we're looking at is 48.5 average active cases per day per 10,000 population. And again, just make sure that you're considering the difference in looking at per 10,000 population. So we have roughly 200 cases, active cases today, 70,000 people. So 48.5 is active cases. So that does, that does jive fairly well. The 14-day sum of new tests per 10,000 population, that's about 1,400. And again, we are doing between 5,000 and 6,000 tests per week. So that jives pretty well. The average percent positivity is about 4.5%. He's looking, the governor's looking at 14 days. We're looking at 7 days, so that is still going to be a little bit higher compared to us. And I just wanted to touch a little bit, since we are discussing the health officer dashboard today, I did want to reiterate some of the components of the health officer dashboard, and then also attached to the agenda, I did include the methods document that I do use when I put together the health officer dashboard. So the health officer dashboard uses 3 primary factors: the number of new cases, expressed as a rate per 100,000, and that's a 7-day average, the percent positivity, and hospital capacity. The primary indicator of spread is the number of new cases. The primary indicator of testing effectiveness is percent positivity. That gives us a little bit better indicator than just tests themselves, because it lets us know if we happen to be missing somebody, or missing particular groups or things like that. If we have a high percent positivity and a ton of tests, that means that we probably need to be testing more people, and the spread is a lot higher than what we think. And then looking at hospital capacity, again, that is an indicator of healthcare capacity. Our hospital system is not the only provider of healthcare in the community. We also know that there's a big impact on long-term care related to COVID, but they would be kind of a final stop for a lot of individuals in kind of the chain of providing care for COVID-19. So we do want to make sure that the hospital is able to rapidly respond to surges in number of new cases, and it's not taxing the system to the point that they're having to delay care otherwise. Secondary factors, the test score and the percent change, those are kind of the modifying factors. So it kind of helps nudge the score in one way or the other, depending on what the trends look like and if we're doing a good job at testing. Our test score, we're doing a great job at testing compared to the nation. So that would be really hard to probably get out of green. The last time we would have been out of green would have been in June, in late June, and that was just a single day. Before that, I believe it was May. And so that's a good secondary indicator of testing effectiveness. And then looking at percent change, that also gives us an idea of spread, gives us an idea of where our trends are going, and then can modify the dashboard slightly one way or the other. So it doesn't have a big influence, but it does have an influence. If we're seeing a lot of spread, we're going to want to look at the a slight increase in the dashboard because we're seeing a big increase in the number of cases. That's kind of a warning sign. Looking at our risk levels, one question that was brought up to me this week is the health officer dashboard designed to be in the yellow or in the orange all the time, and it doesn't really give us any wiggle room. I don't believe that is the case, so I believe it is very possible for us to reach green. The last time we were in green was at the beginning of August, and that was for 4 days at the beginning of August. If we look at the number of days historically, if we look at with our hospital capacity assumed to be green, we'd have about 60 out of 166 days, so about 36% of the days were actually in green, and those tended to be in relatively long periods of time. And then if we assume the hospital capacity to be at yellow, that would drop down to about 24 days. It is still possible for us to be in green as a community with the hospital system in yellow. So what does that look like getting to green based off of where we're at right now? If the hospital is in a green tier, we just need to keep our new case average less than 9.99 per 100,000. So we need to keep our average below 7 cases per day in Grand Forks County, which is something that we have been able to do looking between June 1 and September 15th. We've had about 48 out of 105 days where we have had less than 7 new cases per 100,000. And then we want to keep our percent positivity low and our testing percentage. We want to keep that and percent change in the green. If we look at the yellow tier, we want to keep our percent positivity, our new cases again below 7 cases per 100,000. The number of new cases is a primary driver on this. We want to keep our percent positivity below 3%, and make sure to keep our testing and percent change at yellow or below. One has to be in green, one has to be in yellow, or we can't hit that green level. On the other side, looking at the red level on the dashboard, the red level is actually kind of difficult for us to hit because when we look at spread in the community, one of the big concerns you see is the number of new cases that is going on. But once you get over 25 cases per 100,000, that kind of maxes that out as a factor in there, and then you are looking at other impacts that could happen in the community, such as percent positivity, as well as testing constraints and the trend in testing, and then finally the hospital impact. Where we're at right now, without a major impact on the hospital, just a minor impact on the hospital, or that modified operation where they're nearing capacity, and so they are a little bit constrained. So the green or yellow for the hospital, we'd have to have our cases be in red, our percent positivity be in orange or red, so above 4%, and we'd have to have a pretty significant constraint on either testing or on percent change. That's a little bit hard for me to demonstrate in words, but if we look at the table, one of the good parts about the health officer dashboard is using 5 factors where we can show very easily what different scores would make up a different level. So our key to keeping the health officer dashboard out of red, where we're at right now, is to make sure that we're keeping up with our testing. If we're keeping up with our testing, it's really hard for us to move into, actually move into red. Keeping testing up, percent positivity low, and hospital impact low. Do you have any questions on either the health officer dashboard or on the numbers that I reported today?
Comments or questions? Mr. Veen.
Yeah, just a question. Do you see? I know we're still in the higher level that the governor has placed us in. In some ways, we're better than some of the other communities. Fargo, at this point. Do you see? What do you think it's going to take for him to lower our color code?
So based off of my estimation of the methods that they're using, we are on a good downward trajectory. Since we're using since the governor uses 14-day trends, that kind of slows everything down compared to us. So we're showing a really good downward trend right now, where it's a little bit slower on the governor's dashboard. So I do think that we're probably within a week and a half of falling out of the yellow for the governor and then falling into the green. Cass County, again, based off of my methods, and I haven't been able to fully confirm them yet, I believe they're still actually in a green right now. But on the western side of the state, Minot and Burley Morton, they're the ones that are kind of escalating a little bit quicker into the yellow.
Do you